Greetings to everybody. Thank you for tuning into this video for this session of topics and trauma nursing. Um, great to have you join us, and I hope you find tonight's content very worthwhile. Obviously, this is posted on YouTube, so after you complete watching tonight's or this particular recording, uh, please feel free to pass it on, copy the link and pass it on to any of your colleagues that you think might also benefit from participating in these sessions. These are sessions that are quarterly sessions, and at the end of this presentation, I'll bring you up to date on the sessions for as we go into 2024. So for those of you that have not participated in topics before, it's a quarterly educational offering designed to bring cutting edge topics in trauma and in trauma care to emergency and trauma nurses in New Jersey initially, but really wherever you are, that's totally cool. I've had correspondence from nurses outside of New Jersey, which is great, and outside the United States as well that have participated in previous sessions. So the more, the merrier, right? So the goal is really to sit back, listen to the content, and enjoy. This is a recorded session, so you're not going to have the ability to ask questions in real time. But at the end, you'll see my email address. So if you do have a question or a comment or need any additional information, send me an email and I will get back to you. And obviously, you all know that these recordings are available on YouTube because you're watching me on YouTube right now. So, if you like tonight's session, and you kind of like perusing the journals a little bit, I invite you to participate in a companion program to topics in trauma nursing called Trauma Nursing Journal Club. Once again, we try to at least quarterly, sometimes not so quarterly, put on a session where I pull an interesting article from the literature and we discuss it. In this form. Generally speaking, I'll once a person registers, I will send a copy of the article out to you. And then the night of the session, we'll kind of go over the highlights of the article and then open it up to any discussion people have. This is an interactive session, so if you're shy, you don't like to talk, or you don't like to put comments in the chat box, then maybe the session isn't for you. But like I say, some of these sessions can be pretty interesting. And we'll talk a little bit more about this at the end of the session tonight. All right, well, let's get into it. Tonight, we're going to be talking about ballistics basics, understanding the injury potential of gunshot wounds. The purpose of the next hour and 15 minutes or so is really to discuss ballistics, what ballistics is, what bullets are, what constitutes a bullet, and then how a bullet causes injury. Not so much the injuries that bullets cause and what your interventions are going to be, but more just getting an understanding for ballistics and what all of this means. For those of you that don't know me, my name is Steve Weinman, and I'm with the Division of Trauma at St. Joseph's University Medical Center in Paterson, New Jersey, where I coordinate trauma education, community outreach education, and a host of other projects assigned to me by my boss. In addition to that, I am a pre-hospital clinician, and I serve in the capacity of EMS Bureau Chief for the Somerset County Office of Emergency Management. And I am a 20-plus year volunteer pre-hospital nurse EMT with a volunteer EMS agency here in New Jersey. So again, welcome to everybody, and I hope you find tonight's content useful in your practice. So off the bat, I have nothing of financial interest to disclose, and I am a gun owner. I am an avid target shooter. I've been target shooting since I was probably about 7 or 8 years old and continue to do so to this day, at least on a weekly basis. I try to get out to the range and shoot up some paper. So I'd let you know. So when I speak to you, I speak to you from not only my clinical experience, but also my practical experience in the use of firearms. Ever have one of those days? Oh, yeah. But in the same token, this is probably a pretty decent resuscitation, maybe good, maybe bad outcome. But you know, kind of what we all kind of drive for is we're trauma nurses with our type A personalities. All right, let's talk a little bit about guns and missiles, an introduction to the wonderful world they're in. So, just for the purposes of nomenclature tonight, when I use the term bullet, projectile, or missile, I'm using the three terms interchangeably. And sometimes I just go off and just whichever one pops into my mind first, I'll mention. So, I don't want to create any confusion with anybody. These are not, when I say missile, I'm not talking about missiles of war, anti-ballistic missiles and ground-to-air missiles and things like that. I'm talking about a bullet, the portion of the bullet that will go projectile and ultimately strike a target and cause damage. All right, so let's talk about some firearm statistics. Um, right now to date, and this is as of the 13th of December, there have been 635 mass shootings in the United States. We are on a trajectory to come close to, if not tying, and who knows, maybe even exceeding the maximal number of mass shootings that have ever been recorded in the United States. Um, I hope that doesn't happen, but every night you turn on the TV and there has been a mass shooting somewhere. Now, mass shootings are a conglomeration of both shootings where, by definition, greater than three individuals have been shot at a single incident, or it could be an active shooter incident, which we all know what those are and grimace when we hear another one of those has happened. When we look at deaths related to firearms, year to date, there have been 40,845. This number is growing by about 150 per day. So between the 13th of December and the 31st of December, will we hit the record which was hit in 2021 as we were coming out of COVID? I don't know. But I think we're going to come close. Nonetheless, if we look at the statistics over the last 5 years, the number of deaths by firearm injuries have certainly gone up considerably. And even if they kind of start to level out, still too many. 24% of all trauma-related deaths are firearm-related. So obviously, any of us that are working in trauma centers, or if you're in a non-trauma center and you are seeing trauma patients on a regular basis, that's a large chunk of trauma deaths that are related to a singular cause, if you will. And then, unfortunately, I think we've all heard this before. Gun violence is the number one cause of death in children, and that's never a good thing. So, a lot of trauma centers and a lot of non-trauma centers have certainly gotten out there and tried to get the word out and doing community education on handgun safety, proper stowage of a handgun. My own institution, we give out gun locks, and we've given out probably 600 gun locks, this year, with a hope that at least a fraction of them get on somebody's gun and can prevent a needless tragedy from occurring. When we look at these mass shootings, which I said there's been 635 of them as of December 13th, they occur all over the place. Yes, they absolutely occur in urbanized areas, right? Where we are, down in South, across the plains, and even up into the rural areas of our country. But obviously, we are predominantly here in New Jersey. So what does that mean to us? Well, we get our fair share. So for those of us that are working in trauma centers, particularly in the northeastern section of New Jersey or down in the south to southwest section of New Jersey, we clearly are seeing our fair share of mass shootings on an annual basis. So nobody is really immune to them. As they say, it's not a matter of if it'll happen, it's a matter of when it will happen. And that's true for a mass shooting as well as an active shooter. And again, we continue to see the stats which show really increasing numbers of injuries and deaths that are attributable to firearms. And tangential to that, again, as I mentioned earlier, we are on a trajectory to come very close to hitting the largest number of mass shootings that have ever been recorded in the United States, and that was in 2021. And if you look at the contrast between 2021 over the course of the last decade, you just see that there's been that exponential increase in the number of mass shootings. Does this present maybe the fact that we're leveling off? Well, geez, I certainly hope so. I certainly would hate to see this number go any higher, and I would love to see this number start coming down, but people are people. All right. So let's talk a little bit now about ballistics. And this is kind of the meat and the potatoes of the talk tonight. And trying to get everybody to understand, or if you already kind of understand, reinforce to you what ballistics are and what the injury potential is from gunshot violence. So let's start off with a basic definition. What is ballistics? Ballistics is the science of the motion of a projectile, which again, that bullet, that projectile, that missile, from the time that it starts its flight up the barrel of a firearm, hits open space, and then ultimately flies or has a trajectory um, toward a target, and then hits its final resting spot in that target. And what happens during that trajectory, what the bullet does, and then ultimately what it does as it strikes a target is what ballistics is really all about. Now, when we talk about gunshot wounds, we're not just talking about penetrating trauma. We're actually talking about both penetrating trauma and also blunt force injury. And the blunt force injury will become apparent when we talk about the phenomena called cavitation. Now, not all missiles, bullets, or projectiles produce the same types of injuries. They've said if you've seen one bullet wound tract, you've seen just one bullet wound tract, because bullets, I won't say they have a mind of their own, but they certainly have a trajectory of their own. And despite the fact that a bullet may be manufactured exactly the same way, depending on how far it has flown, what type of tissue it's striking, the density of that tissue, whether it hits bone versus more softer tissue, um, you will get a variety of wounding potential and injury potential from these weapons. And again, that's what makes them kind of interesting from a trauma standpoint, from a clinical standpoint, because you honestly just never know when a bullet strikes a person, ultimately where it's going within their body and what kind of damage it's causing. Now, gunshot wound severity overall is really dependent on a couple of factors. First of all, the type of the missile or the type of the bullet that is being fired from the gun, the type of weapon that is firing that bullet, and then the type of tissue impacted by the bullet, which I kind of have already just said. So let's first look at the anatomy of a bullet. We're going to talk about shotguns a little bit differently toward the end of our talk. So we're going to, and you're going to see that conformationally, the way that a shotgun shell is configured is not much different from the bullet here. So we'll start off with the bullet, and we'll start at the bottom and work our way up. So at the very bottom is what is called the primer. The primer is a very small capsule that contains a small amount of combustible gunpowder, for lack of a better term. And this gunpowder strikes very quickly, heats up very, very quickly, and then serves to ignite the larger powder chamber, which lies just below the bullet in the casing, which holds the bullet. Generally, guns have essentially what is some kind of a striking mechanism in them when the gun is either cocked back or it's in the cocked position, if you will. When the trigger is pulled, it sends a firing pin or some kind of a hammer or some kind of an instrument into the primer or the bottom of the bullet. On some bullets, like a 22, doesn't have a primer, but the hammer hits the bottom of the bullet and causes a transference of energy, which results in igniting of gunpowder. But the primer generally gets struck by a hammer or a firing pin. That in turn does a quick ignition, which then goes on and lights up the gunpowder, which is a little bit slower. And when I say slower, we're still talking in milliseconds. And then that larger load of power then ignites, expands, pushes the bullet out of the casing, and then up the barrel of the gun, out into space, and then ultimately to its target. As you go up the bullet a little bit further, you will see the actual bullet itself. Generally speaking, bullets are usually predominantly some kind of a soft metal, usually lead, and then not totally, and we'll talk about some of the differences in construction of bullets in a little bit. But it's generally kind of a soft lead or a soft metal core that's surrounded by a jacket or a casing. The case, I'm sorry, it's surrounded by a jacket. The jacket will either completely surround this projectile, and then that's where we hear the term a full metal jacket, means the bullet or the soft core is completely jacketed by a harder metal alloy that surrounds it, or the jacket itself may only cover two-thirds, half, three-quarters of the bullet. And then we've got bullets that we have called things like the hollow point bullets and some of the fragmenting bullets and things like that, which again we'll talk about in a little while. But bear no keep in mind that when these bullets are constructed in such a way that they will either inflict maximal damage or they will not inflict maximal damage. And the full metal jacketed bullets generally, I won't say inflict less damage, but they typically go out of their way not to create as much damage because of the way they are constructed in their line of flight, because of the way they're constructed with that full metal jacket on it, versus a bullet that is really built to expand or fragment when it hits a target, which is these bullets that don't have a full metal jacket on them. So I hope that makes sense to everybody. Missiles or bullets also vary according to really four different variables, which we'll get into: both the caliber or the size of the bullet, the velocity or the speed of the bullet, the line of flight or how that bullet actually projects itself as it's moving, and then the construction of the bullet. As I mentioned, how is it constructed? Does it have a soft metal core? Is it a full metal jacket? Is it partially jacketed? And is it designed to fragment or distort in some way, creating larger surface area contact with tissues, thereby creating additional damage? And bullets can vary greatly, if you will, in their size. So what you see on the picture here is essentially the major differences in these types of bullets. I'll pick them up and show you kind of here to represent here on screen the differences. And you might not be able to see these, unfortunately, because of the difference. But on this hand, you can see a 22 long rifle bullet compared to a 50 caliber bullet. So again, little versus big. But in the world of ballistics, little doesn't mean count me out. I'm not going to cause damage. Because if you've ever taken care of a patient who is shot with something like a little tiny little 22 caliber bullet, guess what we know? These little sons of guns can create some major damage by ricocheting around the body and tearing through organs I would say a direct line of path, because it's not a direct, it's a ricochet, but it bounces around and can cause a significant amount of damage. Probably some people would even argue that a 22 probably has more damaging potential than something sometimes like a 9mm, which you see over here, or even a 357 Magnum, which is kind of what this is here. Granted, it is certainly debatable. But look, regardless of what the projectile is, this is a BB from a BB gun, a pellet from a pellet gun, extremely low velocity. But you know what? Don't count these out, that these can't cause and haven't caused some injuries. One of the very first gunshot wound victims I saw was a child who was shot at very close range with a BB. And that BB actually penetrated his chest, went between the ribs, and actually got lodged in the pericardial space. The damnedest thing, but you just do not know ultimately where these things may or may not end up. All right, so let's first talk about missile characteristics. Okay, the characteristics of this particular bullet or this particular projectile as it strikes. So missile characteristics, first of all, really it will count on what is their injury potential. Okay, the injury potential of a bullet is measured by really three predominant factors. One is what's called the kinetic energy of the bullet, or the amount of energy that is imparted from the projectile as it hits a target and dissipates energy, or as it strikes a target, the energy causes it to misshape and or fragment, ultimately creating a situation where it can cause more damage. The second factor is what's called the amount of cavitation. I told you at the beginning, we have some blast forces that are involved here, or blunt forces that are involved. And this is the cavitation, or particularly the temporary cavitation. Permanent cavitation is typically more related to direct line of path of a bullet and kind of directly related to the penetrating component of it, although there's a little bit of a blunt or a blast component to it. But the temporary cavitation, as we will see in a little bit, can create some tremendous forces away from the bullet path, which can impact organs, tissues, cells, blood vessels, nerves, bone that are at a distance away from the actual path that the bullet takes when it hits a target or an individual. And you'll see in a little bit when I show you some of the ballistic gel videos that there is some, distance that these impacts can impact additional tissues causing damage. And then ultimately, what happens to the bullet upon striking a target is also going to be of particular interest. Um, does that bullet stay intact like a full metal jacketed bullet will? It's fully encased, as I mentioned earlier, in kind of a harder metal. So when it hits a target, it doesn't necessarily misshapen. But other bullets are constructed in such a way they've only got three quarters or two-thirds of a jacket surrounding them, so that when they hit a target, they actually will what we call mushroom out or expand out, and that actually increases the surface area of that bullet. And as you increase the surface area of the bullet, it's going to come in contact with more material and cause larger wound tracks and damage. And then ultimately, does the bullet fragment? Does it hit the target and does it become multiple projectiles? So not only do you have a bullet that's now penetrated, but you've now got four or five or six or even more projectiles that are going off in different directions, creating cavities and damage onto themselves. So let's first talk about kinetic energy. This is the mathematical portion, which will put us all to sleep, but it's important in the understanding of how a bullet causes damage. So kinetic energy, by definition, is energy that is transmitted from an object in motion to an object that it impacts. That object that it impacts could be an object in motion or an object in rest. Generally, an object that it strikes that is in motion heading in the opposite direction dissipates theoretically less energy, but probably not enough less energy to severely decrease the injury potential. But the longer of time that a bullet is in air, in flight, it starts to lose some of its kinetic energy. So the longer or further away a person is from a bullet as it leaves the end of the barrel of a gun, theoretically, the less kinetic energy it has on impact. But again, that's all relative depending on the tissue strike, the bullet and how it's constructed, and really how far away they are from the target. Kinetic energy is a result of two factors. It's the mass of the bullet, so how big is the bullet, how much does it weigh in particular, and how fast or what is the velocity of that bullet. Generally speaking, kinetic energy is expressed of ballistics is expressed in the following formula. The kinetic energy of a bullet is half the mass times the velocity squared. Now, what the importance of this is, and what the real takeaway from this is yes, the mass of the bullet, the weight of the bullet is important, but what is even more important in the injury potential is the speed or the velocity of the bullet. And you're all familiar with the terms either high velocity weapons or assault weapons or military weapons, assault/military weapons. So generally speaking, the assault/military weapons are high velocity weapons. By definition, they typically are firing the projectile greater than 2,000 feet per second. Some of them, the military rifles, fire them at greater than 3,000 feet per second. So you can imagine if you are talking about low velocity, which is less than 2,000, and usually somewhere around 1,000 feet per second, the difference between 1,000 feet per second and 3,000 feet per second by looking at velocity squared is an ordinate of quadrupling the kinetic energy by the faster a bullet goes. That is opposed to only doubling the potential kinetic energy by increasing the weight of the bullet. Okay. So that's why a lot of attention is really given to the military and assault weapons, because quite honestly, they cause and inflict more damage. Hunting weapons, hunting rifles are the same way. Not that they're controversial in any regard. Hunting rifles are made to go out and shoot and bring down game, deers and antelope and bear and gorillas and what have you. that are intended to be consumed by the individual. So that being said, those weapons need to have good killing potential, and that's why those weapons are high velocity, but they're high velocity in what we will call low munitions, which means you don't have the typical hunting rifle stoked up with a magazine that has multiple rounds in it. I mean, multiple rounds is in, 15, 20, 30, 100, 200 rounds. Whereas the military weapons certainly can run that boat, and the assault weapons. Now, increased kinetic energy ultimately translates into increased wounding potential. And this is because it's an increase in the overall energy that's transferred to tissues. And it also will increase cavitation, both the permanent cavity, the pathway that is left by the bullet as it goes through a target, and the temporary cavitation, or this temporary blast effect that occurs as a bullet passes through. It creates a cavity, then it creates a larger temporary blast cavity that opens and then closes as that bullet goes through. And that larger temporary cavity distortion from that can cause damage to adjacent tissues that are not directly in the line of flight of the bullet or the pathway of the bullet. And again, we'll see that very shortly, what the significance of that is. In fact, we'll talk about it now. What do you say? All right. So as I've already mentioned, cavitation is really the pathway of the bullet through the body, and in the permanent cavity, the tract that it leaves as it goes through a tissue. The temporary cavity is a larger blast effect that's temporary, usually again in measured often in milliseconds, but the force that is transmitted through that temporary cavity is enough to injure adjacent organs that are not in the direct line of flight of that projectile as it enters tissue. The permanent cavity depends on the caliber of the bullet, which is either the diameter of the bullet and the mass of the projectile. And we'll talk a little bit about what that means. It's the velocity, how fast the bullet is going, and then again, any deviations that the bullet takes as it's passing through the tissue. When we look at calibers, what we are talking about is the diameter and the mass of the projectile. And the caliber is really more the diameter than it is the mass, okay? So you can take a look, and I hope you can kind of see these decently down here, some of these numbers. The diameter is really measured in either fractions of an inch or portions of an inch or millimeters. So for example, at the very bottom here, this is really the smallest fired bullet you're gonna come into contact with, and that's your 22 caliber bullet. 0.22 is what a 22 caliber bullet is. That's 0.22 inches in diameter. If you go up the scope here to what is probably the most common bullet fired from handguns out there, and that's the 9 millimeter, you basically see a bullet that is 9 millimeters in diameter. If you move up the scale a little bit to what's called a 40 caliber, that's 0.4 inches in depth, 0.4 inches in diameter. If you move up, I don't have it here, but a 357 Magnum is 0.357 inches in diameter, 38 Special, 0.38 inches in diameter. If you move all the way up to some of these larger style weapons, you tend to see that these are measured again in millimeters as well, or some of them are also measured in fractions of inches. So again, knowing the caliber, we always say we'd like to know the caliber. Probably isn't the most important thing in the world to know about when you're caring for a tanking trauma patient, but certainly it can lead you to understand what the bullet's potential injury potential was. If somebody is shot with a 22, it's going to be technically, not exclusively, less injury potential than if they're shot over here with a Remington 303. Okay, you can tell much bigger bullet, much bigger field potential, but you also see the casing that it's cased in means there's a lot more powder behind it. More powder, bigger bullet means it's going to travel faster. In this case, high velocity, which means can cause more damage because again, we talked about kinetic energy is half the mass times the velocity squared. So velocity, I already mentioned, low velocity less than 2,000 feet per second, high velocity greater than 2,000 feet per second. Common firearms that we see out there that really fall into the low velocity range are our handguns, our pistols. 38 Special, 45, 9 millimeter, 22. I don't have a 22 on here. 22 has really become kind of an up and comer, if you will, and certainly with target practice and stuff like that, but also people using it for self-defense. And again, we're talking about a bullet with a 22 that travels about 900 feet per second, 38 special, 755 feet per second, 9 millimeter, 1160 feet per second. You can see, obviously as the bullets tend to get a little bit larger in their mass, they're in a shell that carries a larger powder load, which means the explosive potential is there. The bullet pushes out faster, the bullet travels faster, and will cause more damage as a result of its speed as it goes faster. Again, remember, half the mass times the velocity squared. So again, these are predominantly all handguns. Most common out there that you're going to see is the 9 millimeter, followed, I think the 38 special is still out there. We see a lot. We see some 10 millimeters out there. And then people who like to be cool will carry like the 44 magnums and stuff like that. 45s are common too, particularly again in avid gun enthusiasts. When we look at these higher velocity guns, these are the guns that are kind of divided into the military slash assault weapons and then hunting rifles. And again, you can see right off the bat that they are traveling much, much, much faster, high velocity greater than 2,000 feet per second. But more ardently, sometimes they are traveling much faster than 2,000 feet per second. And again, half the mass times the velocity squared tells you that the injury potential is greatly enhanced in these weapons. The ones that are controversial are the assault weapons, the AR-15, the AK-47s, and the derivations therein. The M16 is the military-issued version of an assault weapon. So the M16 is really an AR-15 on the civilian side. And again, these are the types of bullets they fire. These are not particularly large bullets, but they are traveling extremely fast. So guess what? It's not so much the weight, it's the speed, right? Half times the mass times the velocity, or times the velocity squared, half the mass times the velocity squared. And then hunting rifles too. They are to be reckoned with. But again, if it's a hunting rifle, it's out there to kill prey, kill game. Again, antelopes and bears and deer and things like that. So they're going to travel fast because you don't want to have to shoot, unfortunately, Bambi's mother, 15 times to get her to go down so you can make some Bambi jerky out of it. Sorry, didn't mean to go that direction. And then the line of flight of the bullet. Okay, anytime the bullet is traveling out of the barrel of a gun and it's moving across, if there's any deviation to flight, if the bullet just flies in a nice little pattern, then as the bullet hits, just this diameter is going to be what causes damage. But if the bullet starts to turn or do this, or even do this as it travels, all right, then it will cause some additional damage. And these are called deviation from flight. So I will use a 9 millimeter bullet here as an example, although I'm going to be talking in inches, fractions of an inch. So a 9 millimeter bullet is about 0.35 inches in diameter. All right. So what that means is if that bullet is traveling at a non-deviated pathway, right? It's moving through the sky and it's not moving, but it's just doing that. Then as that bullet hits the target straight on, then the exposure is about 0.35 inches of surface area to cause damage. Okay. Will cause damage as it hits a tissue or an organ or a blood vessel or the brain as it hits it, but it's limited. It's limited to that 0.35 inches and then any potential temporary cavitation that's caused by that, which again, we're still going to talk about. If it starts to yaw, and yaw is deviation of flight up to 90 degrees. Boom, 90 degrees. So what you can see will happen with that yaw is that as the bullet hits a target, the exposure is not only just 0.35 inches for the 9 millimeter, it actually increases by about 25% to 0.44 inches. So again, a little bit more surface area, more damage. If the bullet either yaws to 90 degrees or more ardently, if it starts to tumble, then you actually have a greater injury potential. And this greater injury potential can actually increase up to about almost an inch in diameter as it tumbles. Now, the good news and the bad news. Generally speaking, a bullet doesn't usually start to tumble until after it hits a target and it goes into it and it starts to tumble afterwards. If it tumbles beforehand, depending on where that bullet is in its tumble, sometimes it may not penetrate as much. So there's some good with some bad news that's associated with that, if there's ever any good news that's associated with being shot. But again, this just kind of demonstrates that this line of flight is important because you go from being really a third of an inch to almost an inch of surface area that could come in contact with body tissues and cause more damage. That's what it's all about, right? And then there's what we call the mushroom effect. You've probably heard of these hollow points that mushroom, the shroom as it's called. And basically, as I mentioned earlier, the way the bullet is constructed is it's got the soft metal core, but it's got a hard metal jacket around it. If that jacket isn't fully around the bullet and that soft metal core and it hits an object, it'll actually start to expand out or mushroom out as it hits a target. And when it does that, again, creates more surface area to create damage. So here is a 357 Magnum bullet. That's, you can tell it's got this little hollow point in it, so that the where the jacket is, the jacket is really kind of from where the end of the casing that cases the bullet ends, and the bullet will leave this casing, and then you'll see it's only really covered, at least on the front surface, the hitting surface side, probably about 3/4 or maybe a little less of it is jacketed. So it leaves this little opening, which allows this. It allows this mushroom effect, which means the bullet peels back, exposes more surface area, and causes more damage. Again, not a great thing if you're on the recipient end of this. But this also shows you the bullet has gone from being kind of this, which is really 0.357 inches in surface area, to now this, probably a little over an inch, depending on the construction of the bullet and how far these things peel back. So again, that striking you is going to cause a heck of a lot more damage to tissue than that is. So again, you can see construction does make a difference in that bullet. And then what if these bullets are meant to fragment? Wow. So that's a whole new nuance to the bullet as it strikes. And this is ballistic gel. So you can kind of see the path of these bullets, particularly the permanent cavitation, and then where these fragments could come to rest, and the different pathways that they take when they enter target tissue. And as they do so, you can see there's a large kind of permanent cavitation that's here. As this bullet came in, started to fragment, started to kind of do its tumbling effects and stuff like that. But also look at all of these different pathways that this bullet has taken when it fragments. So you not only have a bullet that's coming through and hitting tissue, but now you've got tissue here and tissue here, or organs or blood vessels that are impacted. And then you've also got all of these different points of contact going out and creating little wounding tracks on into themselves. So that's your fragmentation bullet. So let's talk a little bit about kind of this phenomena of permanent versus temporary cavitation. This is some ballistic gel that's a little bit over, I think probably up here. This is probably 30, maybe 36 inches in depth. Generally speaking, about 6 to 8 inches is considered preferential for how far a bullet should penetrate into some body. When you get more than about 12 inches of penetration, the problem is it may go out the other side, particularly in people who aren't particularly large. And that's problematic because if a bullet goes through an object and comes out on the other side, it will continue to flight and possibly hit another target, another person. And that's never a good thing either, right? So let's look at this right here. So on the very, very top track here is a full metal jacketed 9mm bullet. That is that bullet that is completely encased in a hard metal. You can see that it went in, it went through, it caused some permanent cavitation, which is pretty considerable, probably about 2, maybe 3 times the diameter of that bullet. So obviously creating a little bit of tissue damage as it goes through. And then at the end of the day, it went in quite a distance, if you will, right? Quite a distance. So that being said, the distance that it made really would have not only gone through the person that it hit, but probably into somebody standing behind them. That's why it's not good. But I will also tell you, in the state of New Jersey, if you carry a weapon concealed, what's called concealed carry, which is now easier than ever before, you're only allowed on the civilian side, the layperson can only carry full metal jacketed bullets. I don't know why that is. It doesn't make sense. Certainly, they are less injury potential, but they also over penetrate targets and can hit other people. As opposed to things like a hollow point bullet, which law enforcement are allowed to carry, but civilians are not allowed to carry. And that's what you see down here. This is a 9 millimeter hollow point. Now, it didn't mushroom out very well for whatever reason, but you do see that it took a very, very limited pathway. You see that the cavitation really wasn't a lot because, again, the bullet didn't open as much as it should have for whatever reason. But you see it stopped at about the 12-inch mark. So on the average person, this probably penetrated. And depending if they're sitting sideways or not, it probably didn't over penetrate, if you will. But you see in there these permanent pathways that are damaged or permanent damage. It's the path the bullet takes and the destruction that it takes along its line of flight after it hits tissue. Again, this is a higher velocity weapon, and this is actually also fragmented. And a lot of times, these higher velocity bullets will do that. They're traveling so fast that they actually will fragment just because the sheer force on them will fragment them apart as they hit a target. And you see in this particular case, this is an AR-15, a very common assault rifle that is seen on the civilian side of life now. This is only 5 millimeters in diameter. Okay, so this is not much bigger than a 22 caliber bullet, but look at the amount of destruction that happens. First of all, it went in, it caused this a fairly large channel of permanent cavitation. And as it fragmented, because it was traveling at 3,100 feet per second, and it fragmented into multiple little fragments, it created, again, these multiple little different pathways. It also kind of maybe over penetrated. Maybe one of these little fragments maybe over penetrated. But still, maybe not so bad. But the fragmentation, you can see a lot of tissue damage and a lot more tissue damage than we saw with this 9 millimeter going through. And granted, it didn't fragment, but even a fragmenting 9 millimeter wouldn't cause necessarily the same, whoops, sorry, the same type of damage that you see with this higher velocity bullet. All right, so that's kind of permanent cavitation in a nutshell. Let's talk about this temporary cavitation because it is particularly when we talk about these assault rifles and we talk about fragmentation and ammunition. This is where kind of the rubber hits the road and the things that will cause, again, that increased damage to tissue and adjacent organs. And it is very much velocity dependent. So the faster that bullet travels, the larger the permanent cavitation is. And it's relatively short lived. Like I said, it's measured almost in milliseconds, but and you don't see it. And the other thing is you often will not see it on on wound tracks because again it's a snapping of open and it's a closing of these wound tracks that we really don't see unless we are able to video the bullet as it moves through a tissue. So this is the old static ballistic picture that you could see back in the 1970s, 1980s, 1990s, where you basically had still photography trying to capture the bullet as it went through, in this case, again, ballistic gel. Ballistic gel basically is manufactured to approximate the tissue density of a human being. It doesn't take into account things like bones and different, differences between subcutaneous tissue and muscle tissue and things like that. But it's just a crude approximation of the overall density of a body tissue. And it's been the gold standard for decades as to when you shoot a bullet where it goes in the ballistic gel is about what you can expect to see roughly when it hits hits a person, if you will, or an animal, or any other kind of tissue, living tissue. But you can see here in these old static films, you've got the bullet penetrating through. Again, this is a higher velocity bullet. It's coming through, and you see the permanent wound track is there. It's approximately, again, the diameter of the bullet, maybe a little bit wider than it is. And you don't really get a good appreciation for it here. And it might have actually been a little wider to here. But what you really do see is this temporary cavitation behind it. And this temporary cavitation, which, goes up higher and out of the picture, certainly by when all is said and done, can be many, many, many times the diameter of the bullet, which is, again, what makes it more dangerous to think about because it pushes the reach, the destructive force of the bullet, the range out tangential to how far these temporary waves go, these temporary cavitation effects take it. These are some other photographs that we've seen kind of historically, again, looking at, the fact that once again, these temporary cavitation, which we're not going to see after the fact, still is pretty large and pretty many times the diameter of the bullet as it passes through an object. And when we capture the effects, now we've got high-speed video photography, which has really been not a game changer, but it really gives us a better view of the both the permanent as well as the temporary effect. And it's ballistic gel with high-speed video photography. Now, this is a block of ballistic gel. Not cheap to have, but again, this is kind of what we're looking at, and we'll be looking at in the next couple of slides with the videos we have. There are ballistic gel bodies that are out there. You can actually purchase entire torsos from really the just above the pelvis up to the head that actually has simulated organs in them and bone and things like that that you can also use to do ballistic testing on. But they don't really use the ballistic. They don't really use it to test ballistics very much. Some do, some don't, but they're extremely expensive. And I didn't include them in this particular talk. All right, so let's start off with the 9mm. This is, again, the most common handgun that we see out there in the civilian world today. You know, won't say majority, a greater than 50% majority of patients when they come in shot are typically shot with something like a 9mm around the size of a 9mm. So there's the bullet as it leaves the chamber. Here's the bullet as it strikes that ballistic gel, and boom, you see that temporary cavitation effect that it has that you're otherwise not going to see, right? When you're looking at other stuff. So that is kind of the way it is. So what I'm going to do is I'm going to stop this for a second here. And we're going to look at a couple of things. So let's back that up. As the bullet goes in, particularly let's look at the top one here first. This is a 223 full metal jacket. So this bullet is not very large. This is only a 22 caliber bullet, but it's traveling at a very high rate of speed. Don't worry about this 50,000 feet per second crap over here. That doesn't mean anything. This is traveling probably about 2,200 feet per second. Okay. But you see immediately as it goes into this ballistic gel, within the first, maybe 3 or 4 inches of this ballistic gel, you see a couple of things happening. First of all, the bullet is maintaining somewhat of a straight line of flight, but look again at this cavitation that's coming in behind it. Just right here, we already see the cavitation is probably 3 to 4 times the diameter of the bullet. This is all going to be quasi-temporary cavitation. In the bottom here, this is actually an upcharged 223. This is a 223 Chaos. It has got a bullet that is made to fragment upon entry, which you see it doing here. And it's traveling at a little higher rate of speed because it's probably packing a little bit higher gunpowder punch behind it. So what do we see immediately is when it's hitting, it's kind of slowing down in comparison to its companion bullet up here. Because why? It's fragmenting and there's more drag on it, so it's slowing down. But also look at your cavitation behind it, much larger, right? And as we come in, once again, your cavitation is happening much sooner. And what's happened to the bullet here? It started, the predominant bullet that hasn't fragmented, the biggest chunk that's left, is starting to tumble. And by tumbling, what's it doing? It's creating a larger wound path as it goes by. Again, huge wound path here. Even up here at the top, we still see a pretty good sized temporary cavitation wave, but certainly nothing compared to what we see down here. And as we go through the video, we see it even gets a little bit more, I won't say explosive, but even better. So boom. Again, here we have, multiple fragments going here, and you just see this mass effect of temporary cavitation, whereas at least up in here, it was somewhat localized. So again, larger mass effect. And then here, it's kind of interesting. The bullet is now this one fragment has picked up speed, and it's deviated up and is starting to kind of exit through the ballistic gel up here. And this one is starting to do the same. And then again, you come back to rest. And at the end, you're not going to be able to see the permanent cavitation because of the distortion of the video and sooner. Again, you see a considerable amount of damage that has occurred here, which is something to certainly consider. I'm going to go back real quick and take a look at something else here. All right, boom. I don't know why this didn't play before, but I'm going to play it again. So we're backing up and talking 9mm. Somehow the video jumped to the 223. This is your 9mm going through your ballistics gel. once again, you see the course that it took, it didn't deviate from flight, and you see kind of what's happened here. But I want you to take a look at something here that's also kind of interesting. Oh, that's probably what I did wrong. Is as you end up with that, see how you have that temporary cavitation goes away? But look at something here. Boom. What is that? All right. So some people say, my God, there's like a little mini explosion that happened in there. Well, there really isn't. What that is it's called basically photoluminescence. And that basically is just the sheer amount of energy that is in there as it comes back. It actually creates almost like a light effect. It's like the flashing of a camera bulb or something like that, that it's not radiant heat and it's not an explosion, but it does create some luminescence that's in there as well, which I kind of found just kind of interesting. And you kind of see that now that they're doing this high-speed video type stuff. So let's move now to the big daddy of all the bullets. This is the 50 caliber weapon. This is really almost an anti-tank weapon, it is an anti-personnel weapon as well. But this is really for things like trying to get through plating materials of Humvees or tanks or things like that. But it could also be usually a mounted weapon that can be used as an anti-personnel weapon as well. Not so much, not certainly not in the civilian world, thankfully, but in the military setting. And I mean, you talk about a bullet that, first of all, fragments multiple times over here, but the sheer tissue desiccation that occurs when this happens is unbelievable. And that really is one of the takeaway messages from to talk tonight. And we'll talk about it when we look at some additional photographs here momentarily. Is low velocity wounds create damage, but they do not create the damage in totality that these higher velocity weapons, these military and assault weapons make. And look, I'm not on either side of the coin. I don't have a stance when it comes to military weapons or assault weapons versus as handguns. I think a responsible gun owner is a responsible gun owner, right? But that being said, there is a huge difference in the wounding potential between a high velocity weapon and a low velocity weapon. Fortunately, we do not see a tremendously large number of high velocity weapon injuries in our trauma bays or emergency departments. Part of that is because they're a very small fraction of the types of gunshot wounds that are out there. And unfortunately, they're more highly fatal. So you're more likely to die when being hit by a higher velocity weapon, particularly if you're hit in the head or you're hit in, the vital areas of the torso, vascular areas, things like that. So, these are patients that wouldn't even make it in. These are the ones that are particularly at active shooter scenes, because the active shooter has gone from using really a handgun as their primary weapon to now more times than not using a assault weapon. Why a lot of these patients are dead on the scene, because just the egregious injuries they have, and also maybe a time delay in getting some level of medical care into them, that you can try to do some level of hemorrhage control and airway control, and extricating them off the point of injury to definitive care. All right, so that is cavitation in a nutshell. So let's take a deep breath at this point. I'm going to have a sip of my beverage. It's only Gatorade. And let's talk about injury potential that's caused by the construction of the missile. So the bullet itself is constructed in such a way that it causes some damage. So, the construction of a missile can be a major determinant in how destructive a gunshot wound can be. Clearly, that whole cavitation phenomena is a biggie as well. But how this bullet is constructed, and ultimately what its line of flight is, how it hits tissue, what it does after it's hitting tissue, or even before it's hitting tissue, and the damage it can create in the tissue in and of itself, are certainly things to be reckoned with, and why it's important to discuss it. So again, construction. We've already talked about this, but just to kind of relive it, a full metal jacket is a bullet that's typically a soft core, that above the shell, which holds the bullet and will be ejected from the gun or stay in its cylinder if it's a revolver, but will eject the bulleted port. It can be what's called a full metal jacket, which means this bullet is really 100% encased in a harder metal. So it's not that it won't misshapen or even fragment if it hits something hard enough, but generally speaking, it will stay somewhat intact. But will also go further into a target as a result of its not misshapening and the brakes not being put on as it hits tissue. Down here is your hollow point bullet, very, very common, but again, illegal to be carrying outside your house if you're a concealed carrying civilian. And again, these are constructed in such a way that the full metal jacket does not completely encase the bullet. And by doing so, it gives it a weak point that it's now going to misshapen when it hits a target. And then you can have what are called fragmenting or frangible bullets. And these are bullets that, as you can see by looking at them, they don't even necessarily, some of them do, but some of them don't even have really kind of a soft shell or a soft metal in them. They basically are constructed in such a way that the minute they hit, they just break off into multiple segments and go and create their own wound tracks. And each of these wound tracks creates more damage and more chaos. Black Talon, that's a bullet that if you know anything about guns and ballistics, Black Talon is probably the one that comes to mind the most. That was one of the first major kind of misshapening bullets that was really intended to inflict more damage per se by the bullet outside of just a simple mushrooming effect. The Black Talon was called that way because as these hollow point bullets hit, they fan out, and I mean they fan out completely. You take a look here and you see that there actually is no jacketing around these bullets. So what this allows is this allows this bullet not only to mushroom, but to peel all the way back almost to its base, where there's a little bit of probably dense metal there, and create a large surface diameter contact. But look at the surface diameter, what's coming in contact with you there. These razor sharp talons come out, which is why it's called the Black Talon. It's a black bullet with these cool little talons, kind of like little claws on falcons and eagles and stuff like that. So each one of these, even though it stays intact, look at that surface area. This is normally only about 0.357 inches in diameter. In this particular case, this is a 9 millimeter. So this will only be 9 millimeters in diameter, which is 0.35 inches in diameter. But it fans out to being probably an inch, maybe even a little more than an inch in diameter. So it's going to hit larger surface area. And guess what it's going to do as it's ripping through that tissue? Yeah, it's going to create a lot of damage. So these were made illegal. There are a lot of states that made these illegal. These are illegal in the state of New Jersey. You can't have fragmenting bullets. I mean, granted, you can't have hollow point bullets either, but you definitely can't have anything that's, again, this kind of injury potential by law. And it's actually a felony if you're caught with these in a weapon outside of your house or property. Then you've got other bullets that are out there. This is called a glasser slug. It's a hollow point bullet. It's got some metal jacketing around it, but it's got this blue little plastic tip that comes off. And then within it, instead of it being kind of a soft metal, it's got these tiny, tiny, tiny little glass beads that are in there that actually, when it hits an object, they fan out and they create multiple little tiny projectiles that go in and create more damage. This is called an extreme slug down here. We kind of saw it a little bit earlier in one of our other videos. But here we've got, again, a bit of a metal jacket that goes here but stops. We've got a bullet, but within this little metal jacketed area and within the confines here, once the bullet leaves, are these little, basically, barbs of metal that as this bullet hits and it pulls back, the core of the bullet stays intact and continues on its flight, causing damage, but all of these other little metal parts coming off create their own little pathways for damage. So one bullet creating 1, 2, 3, 4, 5, 6, in this case, pathways of damage. Gotta love it. Oh, and these are not cheap either. None of these bullets are cheap. These bullets probably run about 5 to 6 times the cost of a regular bullet, if you will, a full metal jacketed bullet. And some of these are even more expensive. Some of these can be up to $5 or $6 per bullet. But anything in the interest of home safety, right? All right, so let's look at this ballistically. So we've kind of looked at it already, the fragmentation cavitation pattern, but let's look at it again. Now that was a 9 millimeter going through. And once again, what you saw this injury potential, right? And what you saw is as it went through, as it was coming through. Yeah, you didn't see it was not a good photo. This wasn't a good video shot to see that temporary cavitation. But here you get the full effects of the permanent cavitation, which you're seeing right here at the end. So you can totally see where there is, again, massive amounts of damage. And I think we saw this video. Maybe there's a different shot from earlier. But again, you see as it's going in, and this is probably about a 12 to 18-inch block. So probably we're headed here about the 12-inch mark, but maximal damage is within about the first 4 to 6 inches of penetration. And again, you totally see that with this particular bullet. I think this might be the same video. Yeah, it is. Okay. Okay, so this is where if you're eating breakfast or you've got spaghetti and meatballs in front of you, you might want to stop eating. There was a time that if you wanted to get experience treating high velocity missile wounds, you really had to be in the military for it. But now, not so much. And again, I mentioned earlier, high velocity assault rifle type of wounds are not very commonplace, but we do see them, unfortunately, in civilian trauma centers. Fortunately, not as often as we see more lower velocity handgun type of injuries. But when we do, they are very devastating. And the pictures you're going to see are a little misnomers. Not all, a lot of the pictures here that I'm going to show you are kind of headshots, which is obviously maximal fatal um, outcomes. Um, but when we've looked particularly at active shooter situations where we see a lot of the use of these higher velocity, these assault weapons, we tend to see, and there was actually a study that came out about 3 or 4 years ago that actually looked at the medical examiner records out of some of the larger active shooter incidents we've happened. It looked at Sandy Hook in Newtown, Connecticut. It looked at the Pulse nightclub in Orlando, Florida. It looked at the Country Music Festival in Las Vegas, Nevada, which to this date is the largest number of people who were shot in an active shooter mass shooting situation. Little less than 500 people shot and about 50, I think, 48, 49 people killed. But they looked at the autopsy records and saw what were the fatal blows that were there. And unfortunately, the fatal blows in the majority of these incidences were shots to the head and square shots to the torso that involved, obviously, proximity to the heart or the great vessels, right? So that's what we're going to see in some of these pictures here. So again, kind of hold your cookies. But we're all emergency nurses, so I mean, come on, we can be dealing with a GI bleed, gunshot wound to the head, and also kind of eating our Christmas cookies while we're doing it too. So again, and I put these pictures in here for certainly not for shock value. I'm sure I'm not going to probably shock anyone that's watching this, but I put them on here because this just shows you the sheer destructive force of a high velocity weapon. You do not see this kind of wounding potential with a lower velocity weapon. They tend to be more occult in that the bullet goes in, if the bullet comes out, and somewhere in between you may see some internal tissue damage, not often a lot of external tissue damage unless it's an extremity or something. But for these types of weapons, these high velocity weapons, greater than 2,000 feet per second, you see massive tissue destruction. And you see it time and time again. For those of us that are old enough to remember the Kennedy assassination, I call this kind of similar to the Kennedy shot. Not exactly the way JFK was allegedly shot, but the mass effect of being hit in the head with a high velocity weapon is there too. I mean, it pretty much empties your cranial contents. Again, sheer destructive force. That's really what I'm concentrating on here. Because, if this person had been shot in the head with a 9mm, you're not going to see this kind of destruction. All right. Close quarter shotgun, probably so. But that's a little bit of a different bird of a different feather we'll talk about shortly. Getting off the head, here is somebody who is shot going in from the left leg here through massive tissue destruction out this side over here. But you see the destruction in between. Again, a very, very big mass effect on this guy's thighs. Likewise there, you see the bullet. The bullet actually here went in again on the left, traversed his pelvis and exited here and actually brought looks like a lot of material in behind it. So this might have actually been military, or this might have been something where, again, there was a debris field that brought debris in through the wound as well. But nonetheless, again, a massive amount of tissue damage here. And I can only imagine the damage internally to his pelvis. Here is lower extremity. This is the shin. So we got the knee up here, and we got the exit wound from a bullet as it goes anteriorly through the front of the leg, probably going in back through the calf of this person. Gunshot wound to the hand. Again, this tend to see injuries that we see these injuries mostly associated with like stupid idiots that are like in their garage putting together pipe bombs, and the pipe bomb explodes on them, and they end up or holding an M80 fireworks, and it blows off their fingers. But this is actually a high velocity gunshot wound to the hand. So again, you don't see this with the lower velocity. It's just, again, a massive amount of energy dissipated, a massive amount of tissue destruction. Remember, half the mass times the velocity squared. This is a shoulder wound. Here's the shoulder here. No, you know what? I take that back. This is abdomen. This is, I think, the hip. Again, another hip wound. Because here's the guy's hand here, finger with a pulse ox on it. So again, tissue destruction of a bullet that has traversed a pelvis. Here's an extremity. This would be, I believe this is lower extremity, sweatpants still on, knee up here, top part of the leg below the knee. Again, bullet entered here, exited here, sheer amount of force that has gone through with it, creating a tidal wave of damage. And then here's just a compilation of different slides that just show you the enormity of the damage that these bullets cause. I mean, bullet through his Achilles tendon, still intact, so I guess he could dorsiflex his foot if he wanted to. But I mean, you see other things, including the bone has been blown away here. Here's an interesting shot here. This is, again, the calf. This would be calf muscle. This would be the anterior lower extremity. His knee would be up here. His thigh would be here. But you can see entry wound there, exit wound pretty large here. They've obviously made a surgical incision to go in and explore, so it's a little bit artificially large here, but you can kind of get a feel for the amount of damage that was caused, and also the fact that here's his popliteal artery and his popliteal vein that appears to be intact, it looks like. So lucky guy there. Here's we unfortunately see these all too often, is the guy who's cleaning his gun and shoots himself in the foot, right? All right, so that is kind of a summary of ballistics as it pertains to the typical types of bullets that are out there that are non-shotgun related. So let's talk very, very quickly about shotgun wounds, because once again, in the civilian world, we see these episodically, not too terribly common, but we do encounter them. So shotgun wounds are worthy of a little bit different conversation, because even though they are bullets and even though they are projectiles, they act a little bit differently because of the way they're constructed and because of the configuration of what is in a shotgun shell. Typically speaking, shotguns are considered to be close quarter weapons. These are weapons that are very, very effective and can be very deadly, but with a relatively short distance. And usually the proximity is usually about less than 10 yards, so 30 feet or less. All right. The more distance that they get from their target beyond the 10-yard mark, the less likely they are, depending on the shotgun load or the projectile that's coming out of the shotgun shell, less likely they are to create fatal wounds, but they can still create some pretty devastating wounds. Shotguns are often modified to become a little bit more deadly at either further distances or closer distances. All of the modifications are typically illegal. All right, so very similar to the bullet, we do have a configuration of a shotgun shell. So if we look at the bottom and work our way up once again, we have the primer charge at the bottom, which is similar to a bullet. We have a vacuole in here of gunpowder. Around the bottom of a shotgun shell, we have what's called a wadding, and the wadding just sits in there to just create a containment area for the cohort of gunpowder above the primer. Then we have an area between the gunpowder and the pellet, or the area of projectiles, that there's what's called a shell cup. And this all kind of goes in there, kind of sits in here quasi as one piece. Sometimes these are two pieces, but one piece. You put the wadding in, you put the powder in, and then you put the load in, as it is, the pellets or whatever. It's called the load. The surrounding here, instead of it being called a case, is called a shell. So shotgun shell. The projectile is called the load, and then there is no bullet on top, as you'll see, because these are your projectiles. So typically, what will happen is that these shells are about a half an inch, three-quarters of an inch larger, and then the plastic area is crimped down over the top. And the crimping, I don't think you can really tell by looking at this. I don't think I got enough photography to be able to show you, but for the shotgun shell, it's crimped down to where you'll have a flat front to it. And what'll happen is as the primer is hit and as the projectile's load begins to leave the shell, the little plastic covering will open up like trap doors, and the shot will fly its way through into the barrel, up the barrel, and out into the environment. Shotgun calibers, we don't have a caliber. We don't have like a 22 or 45 or a 9mm. We have what's called a gauge. So you can have at the low end something like a 410. You can go then to like a 20 gauge, a 12 gauge, a 10 gauge. And what the gauges basically mean is it's the diameter of the barrel. So the larger the diameter of the barrel, the larger the load that can go through that barrel, and the larger the projectile can be as well. And the more of a projectile that can go through there as well. You can fit more shot or more components of fragmentation in a 10 gauge barrel, because it's a wider barrel, than you can if it's like a 20 gauge or a 410 gauge. And the loads vary. We can run the gamut from very, very, very small, almost birdshot load, to very large, what's called a slug, which could be up to about three-quarters of an inch in diameter. Very, very large slug. I think that in the next slide goes over that. Yeah. So if we look here, you can see the different constituents, the loads that can go into these shotgun shells. This load here and down here are birdshot. And just as the name implies, if you're using a shotgun to hunt, which often you do for very small game, such as birds and pheasants and quail and turkey to some extent, maybe, I don't know, you'll use basically the bird shot. And what that does is it just creates a wider pattern for a smaller target, so you're more likely to hit it. But then you got to dig all the stuff out of the bird if you're going to eat it, or if not, you fry it up and then you're picking it out from between your teeth. Not me, because I won't eat this stuff. But anyway, I digress. Time for another squirt of Gatorade. Hang on. So that's your bird shot. That's usually the smallest constituent load that is in a shotgun shell. Then you can move up to buckshot. Buckshot tends to be larger load. You see that there. You can see it up here. This tends to be something that would be maybe if you're a deer hunter and you use a shotgun, which is why it's called buckshot. Buck being male deer. And then you can go all the way up here. You can see it down here. You've got what's called a 1-ounce slug. You can see the caliber is 0.72 inches in diameter, so about three-quarters of an inch in diameter. That is a very, very, very big piece of metal. And then over here, you can see some derivations that have been done by shotgun shell manufacturers again, for home security, to make these things even a little bit more tumultuous if you get shot with them. So again, you see here we can really run the gamut. Just like with the bullets, you can run a different level of bullets. These are all 12 gauge shotgun shells here and down here and here. But look at the different constituent loads that you can have in them depending on there. So unlike a gun where you really are stuck to the size of your bullet by the caliber of your weapon, the shotguns, you can, particularly the 12 gauge and the 10 gauge, you have a little bit more liberty as to what you can actually fire out of the end, which is why they are considered to be good home defense weapons if you choose to use one for home defense. All right, so the patterns really will vary depending on what the load is within a shotgun shell. This is a typical buckshot load. This is fired, I don't know if it says how far it was fired. It's a 12 gauge shotgun, number 4 buckshot. The velocity coming out, you can see, is pretty formidable. It's like a low velocity weapon at about 1,300 feet per second. In this particular case, there are about 27 pellets that were in there that were striking a target. And you can see that when it strikes a target at a close distance, it creates a lot of damage on the front side, it doesn't penetrate very much. This is only centimeters of penetration on this diagram. So you're only going in about 27 centimeters, which isn't a lot. I mean, I think it's what, about 4 inches or so. But look at the amount of destruction is there from this amount. But this is pretty close. You've got to be, 3 yards, 4 yards, 5 yards away to get this kind of a concentration load. Otherwise, these depending on the number of projectiles, they tend to fan out more and create more sometimes of a peppering effect, which we'll see in a couple pictures here in a minute. So let's take a look at a 12 gauge bird shot shotgun wound as it hits ballistic gel. And what to pay particular attention to is how really shallow it is. We're talking about a brick that goes off the screen here, probably at about 12 or probably about 12 or 18 inches. So again, you see a lot of front up tissue damage. It's really a lot superficial. You see that the pellets, the BB or the buckshot is staying kind of in there. And then this is the wadding. So this is what you'll see a lot of times with shotgun is you'll see, remember how you had that inner cup and that inner wadding at the bottom that you used to compact everything? This will actually project out of here as well and create, yeah, it doesn't usually cause damage, although it can get embedded in wounds. And usually if you see this embedded in a wound, it was a pretty close quarter shotgun shot. But again, you see that, really you've only got, mere inches of penetration in here, right? You see multiple wound tracks, so a lot of damage can be caused by, but you also see that these little buckshot pellets have really not over penetrated. You got a couple that have kind of come out here and created a little strife. Um, but again, very relatively superficial, if you will. That's in contrast to this bad boy. This is your extreme penetrator. Again, it's a slug. Pretty much like almost what you saw with a higher velocity weapon, isn't it? Although it is really a low velocity weapon that's carrying a very big punch to it, in that it's got formidable size. So again, we're talking about 3/4 of an inch in diameter, and more ardently, you're also talking about it traveling at a interesting rate of speed. And I don't have anything to show you what this looks like. Sorry. It used to be we tried to get estimated distances when our patients came in to kind of judge the potential wounding severity of a gunshot wound. This is going back a number of years ago. We used to classify shotgun wounds by three different types, or actually four different types: type 0 to 1, type 2, and type 3. And then we used to get approximation of where they were. Look, at the end of the day, this meant nothing because it isn't so much how far away you were, it was what the load was and how deep it went into tissue. So really, this kind of gave way to what I like to call now the big wound versus little wound dogma. So if you've got a bunch of little wounds, it's probably more superficial than not, and probably not as deadly versus big wounds, which is never a good thing. So again, big wound here, not a good thing. Big wound in a leg, not the worst thing in the world, but you can see a lot of tissue damage and a little peppering effect. So, this is a person who pretty close quarter, but you still are going to get a little bit of a peppering as some of these buckshot in this case, I'm sorry, birdshot begins to fan out a little bit. So there's still a central core of thrust causing the damage, but you still got these lingering little fragments that are going out to the periphery. But again, pretty impressive wound. And here's a cross section of other things that you tend to see. This is more the peppering effect that you see from somebody. So this is somebody who was shot probably, again, using birdshot, distance probably greater than 10 yards. You see a peppering effect. Most of these are going to be very superficial penetration. So probably, dermal, subcutaneous, into muscle. It's certainly, they can penetrate deeper into the chest, into the abdomen, like you see down here. So you don't take them for granted that they have it. You still do your appropriate diagnostics. Each one of these is considered to be, unfortunately, a little penetrating wound onto its own. So you have to then treat the patient more constitutionally for what their signs and symptoms are, what their hemodynamic parameters are, things like that. Here's the proverbial gunshot wound to the foot. This is somebody who actually was holding his rifle, dropped it, barrel landed straight on top of his foot, somehow pulled the trigger and put a slug into his foot. Not a good thing. And then again, here's a larger wound, again, to an extremity, because you can see a broken bone in here. But here you actually see the wadding in here as well. So again, that was pretty close quarter of a shot, probably again 3, 4, 5 yards. The buckshot wound, again, you see larger diameter, but still multiple pellets that are going in, higher penetration. This is post-mortem, so you're seeing some post-mortem bruising. Some people thought maybe these are powder wounds, but I don't believe they are. I really think they might be more just, again, post-mortem looking. And then here again, large scale. Again, you're talking about. It looks like it's probably bird shot, because this doesn't look big enough to be buckshot, although it could be very small buckshot. But nonetheless, the amount of damage to the chest from a relatively close quarter shotgun wound. So again, these things are very formidable, typically at closer distances than longer distances. We've seen a couple of these that have come in that the person was held at bay or was shot by one of these, and they actually reached out and were close enough to where actually were tried to grab the barrel of the shotgun before they were shot. And sometimes you'll see that they've got some pellet strafing up their arm in addition to having a torso hit. And that would kind of let you know that they maybe even had their hand on the barrel. I had one guy had his hand on the barrel. He had burns on his hand. He had some pellet strafing up his arm, and then he had a nice size wound in. It wasn't this part of his chest. It was more kind of in this junctional area here between his arm and his chest, so kind of in his armpit area, the axilla area. All right. Well, in summary, that really is ballistics in a nutshell. At the end of the day, I do hope that this, about an hour and 15 minutes or so has been helpful to you. Here is a compendium of some of the references I used here. Some of them are a little bit older, but they're okay. This Gary Dufresne article is, from my standpoint, just kind of a standardized article. It's kind of a sentinel article, which is why I included it in here. This is from a defunct journal called the International Journal of Trauma Nursing back from 1995. And he did a two-part series, which was nice. I will also call your attention to this book here by Nubile, called Wound Ballistics, second edition, out of Springer Press. It was put out last year. It is actually a nice textbook, about 320 pages. Everything you wanted to know about all kinds of ballistics, from civilian to military to some of the big daddy military type weapons that are out there as well, in addition to that. But at the end of the day, like I said, I do hope that you have found this presentation helpful to you. If it didn't do anything more than to affirm your knowledge base, then that's a good thing. For those of you that didn't really have a good appreciation for what the wounding potential of a bullet was, and you do now, that's a good thing. We're not going to do an open forum, but I will tell you this. Have a couple of sessions that are coming up in 2024. The next issue, or the next session of Topics in Trauma Nursing, will be held on March 13th at 8 o'clock by Zoom. Here's a QR box. If you're watching this on video, freeze it, scan it, and sign up now. You can always never sign up too early. And that'll be on burn care. And then the next session of Trauma Nursing Journal Club will be on February 7th, 8 o'clock by Zoom. You can click that QR code and you sign up for that prematurely. But that one is going to be a closed gloving injury, the Morel Lavalley lesion. This is actually an article that appears in the current issue, the November-December issue of the Journal of Emergency Nursing. So if you have that sitting on your coffee table, your desk, your briefcase, your wherever, and you haven't read it yet, please read it. But if you sign up for this particular session, once we get a little closer, I will send you a copy of this article to read. So by the time we get into February, we'll hopefully be in the January-February issue of the Journal of Emergency Nursing. And but read this now if you can. It's a nice little article, and particularly those of you that are in non-trauma centers, this is a degloving type injury, an internal degloving injury, which can happen for someone as minor as being run over by a car or a motorcycle, or having something fall on them of some weight, and maybe they are not don't have the criteria for going to a trauma center, and they end up in a community or suburban emergency department. So it's a good thing to read and a good thing to take some time with. So other than that, a shameless plug from my YouTube channel, The Trauma Geek. This QR code will get you there. And I've got right now with this video up, I think I've got 13, lucky number 13 videos that are up there that span the gamut from some pre-hospital content as well as some definitive care content for those of us in emergency and trauma uh, hospital-based care. And then, you know what? If those QR codes are not working and you want to reach out and I'll send you a link, I can do that. This is my email address. And again, I appreciate your spending time this evening. Hope you got something out of this talk. And if you need anything, reach out to me. If not, be safe out there. And it's December 13th. So happy holidays to everybody. All right. So take care and see you soon.